I want to introduce Elle Wadsworth, who's a PhD candidate at the School of Public Health and Health Systems at the University of Waterloo. And she works with Dr. David Hammond. Elle is originally from the UK and has a BSc in chemistry from the University of Bristol and an MSc in addiction studies from King's College London. Elle's interests lie in drug policy at a population level, with her PhD thesis focusing on recent cannabis legislation in Canada. Elle is also a 2017 Vanier Scholar, and Elle has a website that we will post at the end at ellewadsworth.com, and you can check out more about Elle and some of her work there. So with that, I'm going to turn it over to Elle to go through her presentation.
Hi everyone. My name is Elle Wadsworth, and as Greg said, I'm a PhD candidate from the University of Waterloo. So I'll be talking to you about the results of a study that looked at international differences in patterns of cannabis use among youth in Canada, England, and the United States. So this is just a slide to show you the funding of the study and to say that I have no conflicts of interest to declare. So I'll not go into a long background of cannabis, but I'll mainly focus by setting the scene to the current cannabis laws in the three countries and at the time of study, which was in summer 2017. So looking at current cannabis laws of medical and non-medical cannabis and how they stand today, starting with Canada, Canada has a legal medical cannabis market since 2001. The most recent medical cannabis law being the Access to Cannabis for Medical Purposes regulations, which replaced all other medical cannabis regulations. Under the Access to Cannabis for Medical Purposes regulations, those with authorization from a licensed physician may either access cannabis from a licensed producer, grow a personal amount, or designate someone else to grow their own personal amount. And for non-medical cannabis, Canada legalized the sale, production, and possession of non-medical cannabis on the 17th of October 2018. England also has access to medical cannabis. However, this is in the form of cannabis-derived medicinal products that are prescribed by doctors. This was recently passed earlier this year due to high-profile cases of young children using cannabis oils for epilepsy. Non-medical cannabis remains illegal, with no intention to change. In the US, over half of the states have access to a legal medical cannabis market. Moreover, although cannabis remains illegal at a federal level, there are now 10 states that currently have a non-medical cannabis market or are working towards that. Now, at the time of study, the cannabis laws were slightly different, and I've circled the ones that are different in red. So in summer 2017, non-medical cannabis was still illegal in Canada. However, there were illegal dispensaries that sold non-medical cannabis. England had one highly restrictive cannabis-derived medicine called Sativex that was legal, but it was unattainable on the National Health Service, nor did it get approval from national guidelines, so it was very heavily restricted. Now, there was a similar situation in the US to what it is currently. However, there was just a few less that legalized both medical and non-medical cannabis. So these different regulatory frameworks provided an opportunity to conduct a natural experiment to examine the differences in patterns of cannabis use, especially at a time with changing cannabis contexts. So this study was taken from the baseline survey of the International Tobacco Control Policy Evaluation Project and a tobacco and youth e-cigarette survey. It was conducted at the University of Waterloo. From this survey, there will actually be 4 annual survey waves, but this presentation will only discuss the results taken from the cross-sectional baseline study in wave 1. Participants were recruited via a commercial sample, and data were collected via a self-completed web-based survey conducted in specifically July and August 2017 with youth aged 16 through to 19. The same methodology was used in all 3 countries, and we had a sample of just over 12,000 participants, give or take around 4,000 in each country. With all that in mind, The aims of the study were to examine the patterns of cannabis use among youth in Canada, England, and the US by looking at 4 primary outcomes: prevalence of use, perceived access to cannabis, perceptions of harm on the self, mental health, and future, and driving after cannabis use, both themselves and as a passenger. So we'll go through each one of these in turn and what we found. So starting with cannabis consumption, we asked, when was the last time you used cannabis? The majority of youth had never tried cannabis. 75% of Canadian youth, 77% of English youth, and 70% of US youth. There are high levels of youth in the US that had used in the last month or ever. Now, when comparing countries from our regression analysis on this data, these data, English youth were significantly less likely to have used cannabis in the last month compared to never than both Canadian or US youth. English youth were also significantly less likely to have used cannabis more than a month ago than US youth. However, differences were inconclusive between US and Canadian youth. The lower rates of cannabis use in English youth compared to Canadian and US youth are consistent with government surveys in each country. Now, looking at perceived access to cannabis, we asked all participants, how difficult do you think it would be for you to get cannabis if you wanted? Over half of Canadian and US youth said that it would be easy, and over half of English youth said it would be difficult. When comparing these countries, English youth were significantly less likely to report that it was easy to obtain cannabis than Canadian or US youth, but no differences were observed between US and Canadian youth. Now, the difficulty seen by English youth may reflect lower prevalence of use and exposure among peers or to retail outlets. For example, medical cannabis is highly restricted and generally unattainable at the time of study, and England does not have access to any brick-and-mortar stores nor dispensaries for non-medical cannabis. Now we're moving on to our perceptions of harm. So we asked all participants, how much do you think people harm themselves when they smoke cannabis? Now, Canadian and English youth were more similar here. Over a third of Canadian and English youth said that they thought that people harm themselves a lot, compared to under a third of US youth. Now, in comparing the countries in our regression models, US youth were significantly less likely than Canadian or English youth to report that people harm themselves a lot when smoking cannabis, with no significant differences between Canadian or English youth. All participants were then asked, how much do you think people risk harming their mental health when they use cannabis on a regular basis? Again, similar to the last question, Canadian and English youth were more similar here, with more participants thinking that people greatly risked their mental health than US youth did. Comparing countries, English youth were significantly more likely to report a great risk to their mental health than Canadian or US youth, and Canadian youth were more likely than the US. Now, in the final portion of perceptions of harm, we asked the youth who had used cannabis, are you worried that using cannabis will damage your health in the future? So 65% of US youth were not at all worried that cannabis would damage their health in the future. 57% of English and 50% of Canadian youth were not at all worried. Comparing our countries in the models, US youth were more likely to not be at all worried than Canadian or English youth, and English youth were more likely than Canadian youth. Now, interestingly, in perceptions of harm, youth in Canada and England are similar on these measures, despite differences elsewhere. This may reflect a greater national dialogue on the risks of cannabis in the lead up to legalization. The lower perceptions of harm in US youth is reflective of previous research that shows an overall downward trend in perceptions of harm among US high school students. So, with a little brief summary so far, it would seem that from comparing the countries, US and Canadian youth have higher prevalence than English youth. English youth have higher perceived difficulty accessing cannabis than US or Canadian youth. And Canadian and English youth have higher perceptions of harm regarding cannabis than US youth. Now on to the section of cannabis-impaired driving. So participants who had reported to have used cannabis before were asked if they had ever driven a car within 2 hours of using cannabis. The majority of all youth had never driven within 2 hours of using cannabis. And from our regression models, US youth were less likely than Canadian or US youth, and Canadian youth were less likely than the US to have driven a vehicle within 2 hours of using cannabis. Now, the same question was then asked of everybody on whether have you ever been a passenger in a car or other vehicle driven by someone who had been using cannabis in the past 2 hours. And similar answers came. The majority of all youth had never been a passenger of a car where the driver had used cannabis within 2 hours of driving. English youth was significantly less likely than Canadian or US youth, and Canadian youth were less likely than the US youth. The large amount of participants who had never driven or been a passenger of someone using within 2 hours could actually be due to the age of the participants. Plus, in the UK, you can only begin to drive at 17, a year after Canada and the majority of the US. It could also be explained by the different drug driving laws in the country and the message that it sends to youth. In England, it is illegal to drive when impaired by cannabis, and there is a low threshold of content in the blood, which would be detected by roadside oral fluid drug screening. In the US, although some states have begun to use roadside oral fluid drug screeners, the majority do not. This means that the police must show grounds of impaired driving before taking the driver in for testing, which by that time, the cannabis may have metabolized in the body. Furthermore, there are wide variations in drug driving laws across the US, potentially sending mixed messages to youth. Now, at the time of study, Canada's laws were more akin to the US. However, legislation, which was Bill C-46, was being created to implement laws similar to England. So those were all our questions looking at the 3 countries. So one of our limitations in this study was that the countries were treated as a single jurisdiction, which has the potential to mask important subnational differences. And this is particularly a limitation in the US, where policies differ from state to state. Therefore, we also performed some separate analyses on the US data and separated the youth into 3 conditions. So here are our 3 conditions. One of our conditions was separating youth from states with an established non-medical cannabis market. So at the time of study, this meant that it was Colorado, Washington State, Alaska, and Oregon. Our second category was youth from new non-medical cannabis markets. So again, at the time, this was California, Nevada, Maine, and Massachusetts. And our third category was youth from prohibited non-medical cannabis markets. And we included Washington, D.C. in this category. Even though cannabis was legal in Washington, D.C., there was no active cannabis market. So we put this with the prohibited market. Now, all the same questions were asked, but I will just briefly go over the summary findings. So when comparing the 3 regulatory conditions, youth in prohibited states had a lower prevalence than youth in new or established states. Similarly, youth in prohibited states had a higher perceived difficulty accessing cannabis than youth in new or established states. Now, however, when we looked at the perceptions of harm in harm to self, harm to mental health, and in the future, all differences were inconclusive across the 3 regulatory conditions. In general, across the questions, we found that youth from new non-medical markets had more similarities with youth from established non-medical markets. perhaps suggesting that the results are from pre-existing trends rather than these policy changes. So that was a brief snapshot of the analyses that we did in the US market, but the paper is actually published in Drug and Alcohol Review with Professor David Hammond, if you would like to know more. And I believe there's a link to that in the PDF version of these slides. So now on to the general conclusions. So overall, this study represents one of the very few that compare cannabis use among youth in different countries. There are substantial differences between Canada, England, and the US youth in perceptions of harm, prevalence, and driving after use. The findings are generally consistent with the overall permissiveness of cannabis policies in each country. So, for example, US arguably being more permissive, with 8 states having legal non-medical cannabis markets, compared to England with no legal non-medical market and no plans to change. You could argue here that Canada sat in the middle with an illegal non-medical market, but with impending legalization. With this in mind, longitudinal research is needed to determine whether these differences are causally associated with policy frameworks or simply well-established secular trends. However, this is an annual study, and so we'll be able to see these trends happening. Before I finish, I'll also mention that I'm a member of the International Cannabis Policy Study led by Professor David Hammond in the University of Waterloo. It is a 4-year prospective cohort study looking at the effects of cannabis legalization across 3 jurisdictions. Now, these jurisdictions is Canada, US states where cannabis is illegal, and US states where cannabis is legal. And this just started with our first baseline survey conducted this year in August 2018, just before legalization. And then we'll have 3 follow-up waves every year after legalization for 3 years. So this is just to say, keep your eyes peeled for that and watch this space. Yeah, and it's a Nielsen commercial panel. And finally, a final plug is that Professor David Hammond and I created a mini documentary series on cannabis legalization in Canada that is available now on YouTube. So if you're interested, I've also added the link in the PDF of my slides if that is available for download. Yes, so thank you very much for listening. I realised that was very short, but hopefully I'm here to answer any questions if you have any. Thank you.
Great. Thank you very much, Elle, for that presentation and on the information. So we will open this up for questions, everyone. You can either put it in the chat on the bottom left corner in the Q&A, and we'll ask it of Elle. The presentation in the bottom right of your screen, you will see a PDF version of the presentation that Elle has allowed us to put up, and you can download for review. So if you can post your questions, if you have questions. But Elle, I do have a question around, probably 2 different questions. One is around the comprehensiveness of the survey itself. I mean, how many questions and how in-depth is it? I realize you presented a very small amount. And then my second question is a little along the lines of the perceptions around drunk driving, because I think there is a perception in the public health and public safety community that impaired driving with cannabis is quite high, but based on this youth one, it would seem it's not as, I mean, it's high in terms of depending on how you look at it, but it's a lot lower than I would have thought. So can I pose those 2 questions to you now, and then if people can have other questions, please.
Sure. So to address the first question with the comprehensiveness, this was just a very smaller section of this survey that was actually on tobacco and e-cigarette use. So it's a part of an ITC survey, so the International Tobacco Control Survey. And this was a subsection of a wider survey on tobacco and e-cigarette use, meaning that this section on cannabis was a smaller section of the tobacco and e-cigarette survey, meaning that it was comprehensive in the fact that it was a comprehensive survey on tobacco and e-cigarettes, but the ones that are on cannabis were the questions that I presented here. And in relation to drug driving, yes, we had. I guess you're right in the fact that it's quite large depending on how you look at it, because we presented those who hadn't, which it looks quite a large amount. And I think is also to hopefully bear in mind of the age range of the people that we were looking at. So some people in those age ranges may not be able to drive due to age, being young, or in the UK we already miss 1 year, so the 16 to 17-year-olds, and then they begin learning at 17, so we might not have missed that. It may have missed that within it. So I'm I've actually forgotten what the main question was. Could you repeat the question of what of drug driving?
Well, I think it was just around those perceptions of driving. I mean, I think the secondary part of that is the those that have driven with someone that have consumed cannabis. And I mean, it seemed, again, it's sort of along those lines of that, we assume that a lot of people have either been with somebody who's consumed or, cannabis and is impaired, or, but I think this, in that age group, they're saying they hadn't. Now, maybe it is attributable to they aren't driving as much as, those that are, let's say, 18 plus. But I think, were those results surprising to you at all? Or, I mean, because it's really the baseline, is it sort of, there's a lot of factors that may be impacting those responses.
Yes, for sure, because I think because it's just the baseline, it's we'll probably be waiting for the other waves to come to see how that is. But I'm trying to think, because we had another survey that was looking at a wider age range. I think this was from 16 to 30, and we had slightly different values there. I'm hesitant to say more about that because I can't actually remember whether they were more or less. However, they were slightly different to the results that we got in our youth use. I will point out as well, with any sort of questions around such a stigmatized activity, that there may be underreporting for those driving and those being as a passenger. So those who were a passenger with somebody who had used in the past 2 hours, it may be easier to say that they were a passenger, which is why there was some higher prevalence of those being a passenger rather than on their own. I hope that if this is low, and this is what people think, that this is low compared to the general public, I hope that it stays, as the youth are the future. But we'll have to see what happens after legalization.
Joss has asked a question around I guess, the original survey questions. Are they still available for access? I guess so. Is the survey and the survey questions, are they available publicly for access?
Yes, I believe they are. I believe they're on a technical report on Dave Hammond's website, and it's davidhammond.ca, and then through there's access to all the studies and surveys that are happening under his group at the University of Waterloo, and within that there's a technical report on this actual wave, and it explains the sample size, the analysis that was done, the amount of people that were in there, and how they were recruited. And towards the end, there is the survey questions are there.
We have another question. So, where's the funding for the upcoming prospective study coming from? Is it from university or federal government or another source? Or
Is this from the International Cannabis Policy Survey?
that's a funded by governments, or is that a?
Yes, it's the funding for the International Cannabis Policy Survey is provided by the CIHR, so the Canadian Institutes of Health Research.
In terms of the post legalization survey, when will those surveys for the Canadian portion be going out? Will it be in a year from now, or will it be in the next few months?
In my understanding, it will be a year from when when we did the baseline survey. So the intention with the baseline survey was to run it as close as possible to legalization happening, so that the second survey, so the first follow-up one, would be as close to a year after legalization as possible. So I think we finished data collection at the end of August, so it would be a year from then.
Great. So are there any other questions from anyone that are participating on the webinar? Well, Elle, I think you've covered it pretty thoroughly, and I think people would be looking forward to the next iteration. I think as we close out here, folks, a couple of things. I would one like to ask you to view the polls and commit a response to them. And I want to thank Elle for agreeing to present today with the data that's coming out. I think one of the challenges that we have in Canada and other places is access to good data and analysis of what's really happening, because I think so much of what we've been doing is based on small data sets and kind of perceptions. And I think it's really good to understand what's happening out there and to be looking for it. So we really appreciate your time and your presentation. And if people have questions, you can, I think Elle had, with the presentation, has her contact information, and check out her website. Elle, do you have any parting words or thoughts?
No, just thank you for listening. And again, if anyone has any other questions that we didn't manage to cover or just pops up, you can happy to be emailed, and I'll get back to you as soon as I can. But thank you very much.
Thanks, everyone, and enjoy the rest of your day.